What's up, beautiful people? Another day, another study. We know high blood pressure affects about half of Americans, and it's a leading cause of cardiovascular diseases and is associated with conditions like stroke, heart attacks, and certain forms of dementia. Previous research supports that nighttime blood pressure is a more sensitive marker of cardiovascular disease than office, 24-hour, or daytime blood pressure markers. Also, we know that a failure in the normal circadian rhythm of blood pressure, so blood pressure is supposed to drop at night by about 10 to 20%. So if it decreases by less than 10%, that's also associated with greater risk of organ damage and cardiovascular events. And in studies, uncontrolled nocturnal blood pressure is common, affecting about 30 to 60% of participants with high blood pressure. This was an interesting study using a combination pill of two drugs that are first line for me, at least, olmesartan and amlodipine, taken at night versus the morning, and then looking at nocturnal blood pressure and circadian rhythm recovery. And I like this study because these are actually the two agents that I use the most when I'm treating blood pressure. And I've actually done this before with patients. I've had them take their amlodipine at night because it is better absorbed at night. There is data supporting better efficacy of taking that medication at night. So at 12 weeks, the mean difference in nocturnal blood pressure was minus 25.3 millimeters of mercury in the bedtime group versus 22 in the daytime group. So a difference of 3, which is actually significant. And also nighttime diastolic was lower in the nighttime group versus the daytime group. And then nocturnal blood pressure control, which is defined as blood pressure is 120/70, was achieved in 79% of the evening participants versus 69% of the morning participants. And we also saw a reduction in the amount of people who had circadian rhythm disruption, who didn't have that drop in blood pressure as well in the evening group, but there was no significant change in the daytime group. Rates of adherence were about the same. And another interesting finding was that there were less dosage adjustments in the evening group than the morning group. A 2 to 5 millimeter per mercury reduction in blood pressure reduces cardiovascular events by 7 to 10%. So the results of this trial are significant. Blood pressure is one of those things where we know that even small changes in lowering blood pressure can cause significant reductions in cardiovascular disease risk. This is something that I've talked to patients about. I've had them switch their administration from morning to evening for certain agents. Now, we can't extrapolate this to all agents, and the study population was in China, so really hard to extrapolate to other populations, but it is something that physicians can try and do try. I've seen success in switching the administration time with my patients. Let me know down below if you've tried this for yourself.